Constipation, almost everyone can experience it at some point, but for some it can become a chronic issue that can affect daily life. Did you know that constipation is one of the most common gastrointestinal complaints, affecting nearly 20% of people worldwide? But what causes it and how can you manage it effectively? In this video, we'll cover what constipation is, why it happens, and how can you treat and prevent it. And we will also talk about lifestyle changes in dietary that can make a big difference. By the end, you will have the tools to take control of this uncomfortable condition. If you or someone close to you has struggled with constipation, watch until the end to learn practical solutions and debunk common myth about this condition. So what is constipation? Let's start by defining it. It is more than just infrequent valve movements. Constipation occurs when stool moves too slowly through the digestive tract, becomes hard and dry and difficult to pass. Generally having fewer than 3 bowel movements per week is considered constipation. Common symptoms include straining during bowel movements, passing your hard or lumpy stools, feeling like you haven't completely emptied your bowels, abdominal discomfort or bloating. How often do you think it is normal to have a bowel movement? Share your thoughts below. What causes constipation? Constipation can result from a variety of factors. Here are the most common causes. 1. Dietary factors. Low fiber intake is one of the leading causes. Fiber helps to bulk up stool and move through the intestines. Dehydration can make stool harder to pass. Another one is lifestyle factors. A sedentary lifestyle or lack of physical activity slows down digestion. Ignoring the urge to go can lead to a buildup of stool in the colon. Medical causes. Certain medications such as painkillers, calcium channel blockers, and antidepressants can cause constipation. Underlying conditions like irritable bowel syndrome, diabetes, or hypothyroidism may also contribute. Stress and travel. Stress or changes in routine like traveling can disrupt your normal bowel movements. Have you noticed any patterns or triggers for constipation in your life? Let us know in the comments below. Treatment options for constipation. Fortunately, there are many ways to manage constipation. Let's look at the most effective treatments. First, dietary changes. Increase fiber intake through foods like fruits, vegetables, whole grains, and legumes. Drink plenty of water. Aim for at least 8 glasses a day. Lifestyle modifications. Incorporate regular physical activity into your routine. Even 20 to 30 minutes walk can help stimulate bowel movements. Establish a regular bathroom routine and don't ignore the urge to go. Over-the-counter remedies. Mild laxatives like fiber supplements, psyllium, or stool softeners can be helpful for occasional constipation relief. Avoid overusing stimulant laxatives as they can cause dependency. Want to see a doctor if constipation persists for more than 3 weeks, is accompanied by severe pain, or includes blood in the stool. Seek medical attention immediately. Prevention strategies. The best way to deal with constipation is to prevent it from happening in the first place. Here are some tips. First, stay hydrated. Drink water throughout the day and limit dehydrating beverages like alcohol or caffeinated drinks. Second, eat more fiber. Incorporate foods like apples, pears, broccoli, oats, and beans into your meals. Third, stay active. Regular exercise like yoga or breeze walking keeps your digestive system moving. Next one, manage stress. Practice stress reduction techniques like meditation or deep breathing to help regulate digestion. Fifth, limit processed foods. Reduce your intake of low-fiber processed foods like chips, white bread, and sugary drinks. Common misconceptions about constipation. Before we conclude, let's address some of the common misconceptions about constipation. First one, you must have a BBL movement every day. Truth is normal. Frequency ranges from 3 times a day to 3 times per week. Second, misconception is laxatives are always Harmful truth is when used occasionally, and as directed laxatives can be a safe way to relieve constipation. Did you know? About any of these misconceptions, share your thoughts in the comments below too. Summarize: constipation is a common but manageable condition with simple changes.